Good morning. Greetings from the Institute of Global Professional IGP Bangladesh. Greetings from the Institute of Global Professional IGP Bangladesh. With the ad. Honorable Knowledge Seeker, today I am your host for the morning. My name is Padmandash. I am from Bangladesh. Dear Knowledge Seeker, I am proud to be associated with IGP as a global member. IGP is a social and IC certified international training institute. In 3 years, we already served 3 million plus knowledge seekers from 100 plus countries. IGP is internationally recognized and globally accredited. We are connected to more than 250 plus professions and 4,500 plus organizations. Institute of Global Professionals (IGP) is the training faculty for skill development which was founded in 2020 and is generating competent candidates to meet demand in the global labor market by providing professional qualifications. The Institute of Global Professionals is an education institute that provides social work globally recognized and reportable. We serve students and community resource providing housing, work, and education. We believe that it's not effective to increase one skill just by acquiring formal education. So we try to provide effective training and consultation to generate proficient generation all over the world. We distribute our services locally, nationally, and internationally to students, job seekers, job holder, and also for learners through respective campus location and distance running platform. We are an occupational and dependent IGP is one of the famous online institutes from all over the world. Our vision is education is not a business product, it's a part of our human rights. Based on trying to reach all corners of the world for free webinars, seminar courses about quiz competition, mentoring, and counseling, etc. On the other side, we also try to give them content services for free, like create own portfolio, resume builder, cover letter, motivation letter, and knowledge platform for gathering general knowledge, which can upgrade all learning game, website, free courses, conversize, and many, many more. We help to empower you to learn, keep the expectation and dreams, and become highly skilled people. We implement several trainings, program, webinar, and offline online courses for youth and learners by professional trainers, speaker, and coaches. Our sessions are conducted by globally renowned professionals of youth and to promote the education of their abilities and personalities. To ensure excellent and in-depth instruction, we are with qualified trainer, speaker, and instructors. We extended free services to more than 3 million knowledge seekers in the last 3 years. We collaboration with universities and organizations in 70 different countries. Virtual mall signing with many colleges and organizations have been accomplished. We are looking to create legendary scholars and citizens who will be accountable. We are constantly prepared to assist all knowledge seekers with valuable service. Spreading knowledge for the Institute of Global Professional. We believe that knowledge is love and light and vision. So we try to understand the needs of today's generation and we serve them with good research and practice method. To us and concern for the learners we represent. More diversity, growth, and innovation are required to lead a session with professionalism, passion. IGP members are committed to offering effective, best quality service and continual improvement so that individuals who seek information can improve their skill. Before we move to the next, let me remind don't forget to share, tag, and mention your friend in the comment box. Your support is very valuable for us. Thank you. Before we move to the next, let me remind don't forget to share, tag, and mention your friend in the comment box. Your support is very valuable for us. Thank you. Moving to the next, with your continuous support, we already completed 1,206 webinars successfully. Wow. Moving to the next, with your continuous support, we already completed 1,206 webinars successfully. At present, we are going to start our 1,207 program name is Guide for Occupational English Test Exam and our speaker name is Ma'am Dr. Khadijatul Kubra. Before I hand over the stage to ma'am, a very little bit about our speaker. Medical officer in ICO, Ehsan Mumtaz Memorial Hospital, Lahore, Sharif Sargimit Hospital, Okara. Now, very important moment for me to invite our speaker to IGP with her presentation. Now, Very important moment for me. We invite our speaker to IGP with her presentation. Hello, ma'am. Good
Hello.
morning.
Good morning. Thank you for having me. Shall I
Most
start?
welcome, ma'am. Now, IGP knowledge seeker wants to hear from yourself. Yes, ma'am. You can start.
Hello, everybody. I would like to thank IGP professionals for having me today. So I'm a doctor from Pakistan, and I will guide you. I have given this exam, occupational English test, and I will guide you to my best possible ability to help you, so you can understand what kind of the exam is and how you can ace it, what its sections are. So first of all, let's move forward. Let's take a look at the overview of the sections. First, we are going to discuss what this test is and of all the professions who can take the OET and the countries which recognizes it as their test taking ability. The test section details their grading system. Like as we know that IELTS tests, they are graded on the basis of the band scores. OET are graded on the basis of their specific grades like A, B, C, and D, and we are going to discuss it in detail further. Then we will move to the specific parts like listening, reading, speaking, and writing, which concludes this test. So without wasting any time, let's move forward to what the exam is. OET, it's an occupational English test that assesses the communication skills of a professional, basically a healthcare professional who wants to register and practice in an English speaking environment. It not only tests the communication skills, it also judges based upon the concisement, how you understand, speak, respond to the English questions, to English conversation, and how you can speak the specific information, understands it. It has actually four sections: reading, listening, speaking, and writing. The official website is OCCUPATIONAL Occupational English Test.org. What we can get from this website, it's a website to guide you of any kind of test information, which includes the different test sections, test centers in various countries of the world, European countries, Arab countries, and the free samples. After practice, you can go to this website and you can give the free sample testing to judge you on what you're scoring, and it will help you to be confident on the test day. Then we have the rules and regulations of what for the candidates as well as the invigilators of the various countries where the exam is being conducted, as well as the types of test. OET are actually conducted as on the paper as well as its computer-based testing. First, it was launched on the paper, and recently it has been also it's given an option to the candidates whether they can give it on the computer and on their home screens. So so what happens? The invigilators give the environment, and they give the specific link, and where the candidates can give the exam on the computers, and they are assessed on that. The candidates who are good in computer using and typing, they are more likely to choose the computer-based testing, and others who are comfortable with writing, they can choose the paper-based test. Next, we have who can take OET. It's actually for health professionals, but as we all know that there are multiple types of health professionals. It can include the medicine, doctors, nurses, physiotherapists, occupational therapists, optometrists, and pharmaceuticals, dentistry, veterinary sciences. Other than that, it also includes the speech pathologists, radiographers, and the podiatrists, the persons who deals with the diseases of the foot and lower limbs. So what actually this health professionals, why they take OAT? OAT they take if the person wants a specific job or for examination to shift to a specific country, they can take the exam that has the basic English language as their first language. So they take it so that they can converse with the patients there when after immigration. Who recognizes it? Multiple countries, whole world. It can be Arab states, it can be United States of America, Canada, United Kingdom. We all know that maybe, but some of you are familiar that the ECFMG, abbreviated for Educational Commission for Medical Students, graduates, medical graduates, foreign medical graduates, they recognizes OET for people who wants to practice medicine in US through match residencies. They are given, they have to give the OET exam. And important thing is, although the grading system is, the passing grade is B for every section, but for the United States of America, they have a little bit of leniency for the last year regulations. In writing section, one can take C and it will be considered a pass. I will tell this in detail in the further slides, as well as the Australian Immigration Services, Home Services, healthcare regulators, Canadian healthcare regulators. For United Kingdoms, if you are going for a residency there through labs or through MRCPs, you have to give OET to be eligible for their jobs. In United Arab Emirates, Dubai, Qatar, you can give it, as well as for Ireland, you have to give the OET and have the passing grades. New Zealand, and there are multiple others, including Maldives, Egypt. These also accept the OET. Now coming to the main body of the test. I hope you're getting it. If you have any questions, you can comment it, or you can, I will try to answer as you ask. So there are four sections of the test: listening, reading, speaking, and writing. Each section constitutes specific timing. Listening constitutes 45 minutes total. And in these 45 minutes, we have three further subsections of the listening test. Similarly, it was followed by reading. It has 60-minute section, and it has also further three subsets. For writing, there is just one question, one letter on which you are assessed, and it will take 45 minutes. 5 minutes of reading the question, reading the case notes, and 40 minutes to write it. And then the speaking section. Speaking section is a little bit easy section, and it just constitutes two subsets of 5 minutes each. I will guide you each and every section in detail. Hope it will help you. Then we have, first of all, moving to the details, this is the grading system, how it looks like comparable to the IELTS equivalent band scores. This is the grade A, grade B, grade C, and C+. The passing grade is grade B. Scoring starts from total marks are 500. The passing marks are here mentioned at 350. As you can see the lower bottom on the OET score sections, it's the 350 is the passing score. And it's equivalent to 7 to 7.5 on the IELTS band score. C plus and C, which is below 350, they are not considered passing score. Only and only an ECFMG for foreign medical graduates, they take the C grade as the passing score for writing subsection only. Please keep that in mind. But every day they share a new, every year they share the new regulations. This year it will be released in, I think, March or May, March till May, and we will see that they continue the same grading systems or not. Up till now, C is considered the passing grade for foreign medical graduates for ECFMG certification. Then coming back to the details of the listening subsection. It has three subsets as I've mentioned earlier, A, B, and C. Total of 42 question items in this. First of all, part A. The specialty of part A that it tests the specific information. You have to write the specific information what you hear in the conversation through your speakers. You will be provided the headphones through which you are listening a specific conversation on the test day, and you have to write what you are here. Speciality is you have to write the same wording as what you hear, and you have to write it there. This spelling, there should be no spelling mistakes. There should be no change of words. What is actually present in part A? You are going to listen the recorded health professional and patient consultations. A doctor is going to consult. It can be a doctor, it can be a physiotherapist, it can be a podiatrist, it can be a speech pathologist, but it is going to converse with a patient, and what they are discussing, you are tested on based upon what they are discussing. You have to be very vigilant upon listening that. 2 extracts are present. Each extract have 12 blanks, so total 24 out of 42 questions are tested in part A. If I can give you the example, this is how it looks like a sample of part A. I hope it's clear to everybody. So this is a sample taken from the official website. When you are going to give exam, some of you who will give the exam and give the sample free test will be aware. This is how it looks on the test day. This is your question paper, and these are the blanks. 1, 2, 3, 4. You can see it's labeled. It's the extract 1, and you have to fill each point as you hear. Same wording. Obviously, it depends upon your efficiency, about how clearly you hear. You can increase this ability by listening to the various podcasts, which you're listening to the BBC, as guided by the official test takers and test invigilators. What is written, if I can read it for you. You hear a physiotherapist talking to a new patient called Ray Sands. This is the question numbers, and you can fill the notes with word or a short phrase that you hear. After that, there will be a pause of 30 seconds. You can read and take the overview of the blanks, and then you are going to fill it. The important point is you can only fill it and you are only going to listen to the conversation once. You cannot pause, you cannot repeat. If something is missed, it's missed. You have to be vigilant enough to get it, to pick it up in the very first as it flows. Then we have the part B. Part B is actually, it tests the ability to identify the details. Here we have, as we have discussed, the 24 questions are in part A, and then we have next 6 questions from 25 to 30 in part B. Each part has the specific question. Each question has a specific 4 to 5 lines of conversation. It not only includes the doctor-patient conversation, it can also include the team briefings, the handovers between the residents, or some dialogues or some interviews, and you're going to answer based upon the one multiple choice for each extract. Sample is given in the lower right corner. That's how it looked like on your exam day. In this part of the test, you will hear 6 different extracts. Each extract, you will hear people talking in different healthcare settings. For part 25 to 30, you are going to choose the best possible answer. If we go to the question example, it say you hear a nurse briefing her colleague about a patient. Then you are going to be given a pause. You are going to read the question, and then the conversation follows. The conversation will be just of 4 to 5 lines, and you have to pick it's the details. Actually, all 3 questions will be relevant, but you have to pick the specific detail. That's why this section is specialized as the ability to identify the detail how a candidate can fill the best possible choice. I hope it's clear to you. Sorry. Then we have the listening part C. Actually, listening part C is a little bit of lengthy. It's a lengthy question, lengthy section. We have 2 extracts, each extract of about 6 to 8 paragraphs. But there is no need to worry. Why? Because it is tested on the basis of the candidates. It's an easy section after you practice in your homes and before giving the test. So we have the what? How many number of questions we have left? 12. So 6 per extract. You are going to be tested for part C, and then 42 questions will be completed. Then you are going to hear an interview. You will be given 90 seconds first to read the questions for 1 extract, which is followed by the conversation. Then you are going to given 90 seconds for the second extract, and then you are going to hear that interview. That's how it will be tested, the listening section. Here, the important thing is that you are not going to hear the exact wording of the test, of what it is given in the section. You are going to hear, you have to pick the question upon what your concepts are, what you have got and taught from the conversation. For example, there is no specific wording as I have discussed it in the part A. In the part C, there will be some interview and you have to guess it. What is the best possible answer on the basis of concept? So it will test your skill of understanding the concepts rather than just the specific information. It will include 12 questions. Then this is the last section of listening test. After that, you will be given 2 minutes to complete or to erase, or important thing is you have to complete the test with a lead pencil. You can use eraser if you are giving it on the paper, test paper. You will be given 2 minutes if you want to complete, and then your answer sheet will be taken. Next, we have reading section. I hope you are following me in this section. I'm trying to guide you in the best possible way, and trust me, it will be an easy if you just follow these guidelines. It would be easy for you. So reading part is a bit of similar to the listening part in just that it has 3 subsets. It is 42 questions. But the trickiest part is that in reading, we have part A. It is a very sharp, you can say that it's a very sharp skill. It tests the sharp skills of the candidate because you have important thing is you have 15 sharp minutes. You are given 4 paragraphs in part A. After 15 minutes, your part A test sheet will be taken. 4 paragraphs are given. Each paragraph has its own headline, title. For example, if a specific disease is tested, is the part of the question, paragraphs. Then the four paragraphs are titled as maybe paragraph 1 diagnosis, paragraph 2 signs and symptoms, paragraph 3 tests for assessment or the risk factors, paragraph 4 treatment. And you have 20 questions. You have just to write a short phrase, word, or the paragraph name like A, B, C, or D from which that question is taken. Let me show you an example, then you will get it. This is the sample of the reading part A. For example, the question title is paracetamol overdose. So we have a bit of idea what's the paracetamol overdose we are tested upon. Then we will be given four paragraphs. Then it's diagnosis, signs and symptoms, treatment, and risk factors. So what we're going to do, let me read it for you for your understanding. For each question, decide which text A, B, C, or D the information comes from. You may use latter more than once, in which text you can find information about various symptoms. Then you are going to see the symptom in the symptoms paragraph. The precise levels of paracetamol in blood which requires intervention. Intervention means treatment. You are going to look for the treatment section. Steps to be taken when treating, then it's again the treatment section, whether paracetamol overdose was intentional, the signs and symptoms, the reason, the risk factors, number of products, what to do if there are no details available. So how I tell my students to test this, to do this in the best possible way. So we have 15 minutes of reading section. For part A, for the first 2 minutes, quick overview, which paragraph belongs to which section. And then we are going to start from 8 to 20 questions first. Why? Because it has a word, a short phrase in it. For by reading this and filling this, we have a very detailed idea that what is present in each section. Then it will be easy to mention it here in the paragraphs, which paragraph belongs to this. So 1 to 7 question will be much easier. And this can only be done by practice. There are multiple sample tests, and from where we can test this, it will be available. I will show you from where you can test the questions. Then we have the reading subsection part B and C. It will be the question sample will be given together. It will collectively constitute 45 minutes. Part B assesses your ability to identify the details, gist, or main point of 6 short texts sourced from the healthcare workplace. It's quite similar to that of listening part B. And part C assesses the ability to identify detailed meaning, opinion, concept in the two texts on topic of interest to the healthcare professionals. The edge of this test, OET, is that the language, the concept is clear to the test takers, the candidates, because test takers are professionals, health professionals. So the language is accessible, language is understanding. It's not new when you present in the test. So it's quite an edge because you don't have to be startled while giving the test that what's from where it has come from. It's very, very familiar to all of you. Part B and C collectively take 32 questions. Sorry, it's not 32. It's 22 questions. 6 questions constitute of part B and 16 of part C. This is the example. Let me go through with you this example. This is the manual example. You are going to, it's exactly as mentioned as on the paper, and this is how it's appear on the paper. You are given this paragraph. You are going to go through this paragraph, and this is the question the MCQ, the possible question. You are going to read the question and then you are going to pick the best possible answer to that. For example, this paragraph is related to the digital automatic blood pressure monitor. You are going to take it, you're going to read it thoroughly, and then you're going to choose the best possible answer. This, similar to this, we have 5 more questions, total of 6 of part B. And this is how it looks like up in the part C. Similar to the listening section, it has 2 parts. 2 extracts, each extract of 6 to 8 paragraphs. And from 6 to 8 paragraphs, you are given 8 questions each, total of 16. And that's how the reading part C sample concludes. This now concludes your listening and reading section. I am guiding you as it will be given in your exam. In exam, you are given first the listening section, then the reading question, and then the writing subsection. It's actually a task to write a letter. Yeah, we have written quite a letters in our schools, colleges, but this is specifically tested for a healthcare professional. Task is to write a letter, usually a referral letter. What does that mean? It means that there are 4 types of letters which we can have on the question exam. Now, for some are referral letters, then we have discharge letters, then we have transfer letters, and then we have update letters. What does this letter mean? Referral letters mean that a general physician of a family physician of a person, of a patient, is going to refer a patient to a hospital specialist. Like it can be a gastroenterologist, it can be a cardiologist, it can be a endocrinologist. This referral, what we have, he is going to write a letter. I have to write a letter to to refer a patient to a hospital subspecialty. And a transfer letter means, for example, a patient is, because you are a doctor, you are a health professional. This letter is going to be according to which health professional you are. If you are a nurse, you will be tested based on that. If you are a physiotherapist, you are given a letter based on that. If you're a doctor, then you are going to be a doctor on the exam. Then we have transfer letters. Transfer letter means you are going to transfer a patient to some rehabilitation center, to a hospice care for further management. Update letter means the patient is admitted to a hospital and you have to update to its general physician on what you are treating him and how you are treating him and what's the changes, how the improvement is, how the patient is responding to the treatment. Then we have the 4th type is discharge letter. Patient came to you. It can be of trauma patient. It can be of any patient, any problem. You have admitted the patient or some elective surgery. After a few days, couple of days, 4 days, 6 days, the patient is he is okay. He is improved. His scars, wounds are healed, and now you are going to discharge it. And for follow-up, you are going to write a letter to the general physician for telling him that I am discharging a patient. A letter to advise or inform a patient, carer, or a group is sometimes used in pharmacy, veterinary sciences, occasionally for speech pathology and occupational therapy. Along with the task instructions, you will receive a stimulus material, case notes, and the documentation, which includes information to use in your response. In the letter, you are judged on the concisement, the clarity, the grammar, the language skills, the content of the letter, how you write it, and then you will be graded based upon your letter. Let me show you. This is the writing sample, if it's visible to you. That's how it will be given to in your exam. Mrs. Priya Sharma is a patient in your general practice who is concerned about her glucose control. You are given details about the patient, then address, social background, family history, medical history, current drugs, and your further appointments, and then the task. This is the task. What you have to rewrite out of that those case notes I've shown in the last slide. Using the information in the case notes, write a letter to Miss Mantha Bruin, senior nurse at Grace Walls Nursing Home, 27 Station Road, Grace Walls, who will be responsible for Mr. Baker's continued care at nursing home. So, from the writing task, what we get that this is a transfer letter. We are transferring the patient to a nursing home. Why? For further rehabilitation, for further continued care. In your answer, expand the relevant note into complete sentences. Do not use the note form. Use only letter format. The body of letter should be approximately 180 to 200. So, the guidelines are you will be given 2 pages. You have 45 minutes, 5 minutes to read the case notes, these case notes, and interpret them, and for the 40 minutes to write it. The two important things to remember that do not use the same wording. Like it's written 1999 type 2 diabetes. You are not going to write it as it is in the letter. You are going to write the patient is suffering from diabetes type 2 diabetes since 1999. You have to use your letter wording. Otherwise, it will be marked negatively. I hope it's clear to you. Then we have okay. So we are to the last section of the speaking subset. It's what is the speaking subsection includes? It includes you are going to receive the information for each role play on a card that you keep while you do the role play. The card explains the situation and what you are required to do. You may write notes on the card if you want. Role plays are based upon typical workplace situations and reflect the demand made on the health professional in those situations. 5 minutes for each role play card. Let me show you and explain it further. This is the card. This is how your role play will be assessed and you are given. The invigilator will simulate as the patient and you, candidate, will be simulated as the health professional, whatever professional you belong to. The invigilator will hold the patient card and you will be given doctor or nurse card. For example, here I have a nurse card. You have 3 minutes to prepare the roll card. And then the timer will be started. The invigilator is going to record the whole conversation. Then it will be sent to the examiners and then you will be graded based upon that. For example, let me read it for you. The nurse section. This is the scenario. The patient is in a hospital following a road accident. The patient's condition is stable, but he has lost blood and needs a blood transfusion. Patient does not understand what will happen. The patient is anxious about the procedure. So the task is find out about the patient's concern, reassure the patient about the possibility of infection is very small and it will be taken care of. Explain the procedure for blood transfusion in details. So what actually is going to be tested upon the speaking sample? How you start the conversation with the patient. Everybody know that being a health professional, it's us utmost require that we first build a rapport with our patients so that they can trust us we can be so they can freely converse with us, and it will be easy for them, so that they can trust us and they can be treated in the best possible way. And secondly, we have to give them the details about the treatment, about the risk factors, about the duration, about the complications, as you do in the actual healthcare settings. For example, this is how you are assessed: the linguistic criteria and the clinical communication criteria. For linguistic criteria, intelligibility, how you are going to interpret the cards, the fluency, how much stuttering or how much breaks you are taking. Because if you are taking breaks, it will be visible to patient as a confused doctor, confused health professional, and it will put a negative marking. It's not just about the exam, it's about the actual settings. You have to be confident with the patient because you are treating him, his health. He is trusting you with his health and he's anxious. You have to talk to him. The appropriateness of language. Use a professional language, the trustworthy, the empathetic language, the resources of grammar and expression. Clinical communication criteria, the relationship building. How you are going to build a relationship, which we call rapport, with the patient. For example, I tell you a very good part is that if you have to include the empathetic answers. For example, let me tell you, here this is the card roll, and what we are going to do after the timer starts, we are going to first introduce ourselves with the patient. If it's emergency settings, we have to be careful because the patient is in critical condition. We have to reassure the patient. We have to take him in our trust so that he can allow us to treat him in the best possible ability. We have to be empathetic so that he knows that we are well familiar, we understand the pain. This is how we can go with the patient. And this is how we will converse it. In the 5 minutes, you have to complete one role play card, and then there will be a short time gap. And then you will be given the second role play card. And again, 3 minutes for preparation and 5 minutes for its presentation, conversation with the invigilator. Then we have discussed the speaking assessment criteria. Then we have the preparation guidelines. From where you are going to prepare. It's a bit, trust me, it's a bit easy test. You have to prepare it. You have to do a smart work to prepare it, to ace it. All preparation guidelines are given on the official website, which I've mentioned in the very first slide. Every section, 3 sample tests of every section are present on the official website. Other than that, you are given the free test courses. You are given the guidelines. You are given the oral question answer sessions every fortnightly. You can converse it on the YouTube channels of official OET test. Other than that, it also includes the subscription packages, writing guidelines. Other sources includes the benchmark. What it actually is, it's an actually website where you can subscribe for reading test guidance, one-to-one sessions with the examiner, and he is going to test you based upon your ability as a practice test. Yeah, obviously. The other test is E2 language website. It's also a website, and it has all the sections, and also it has free material as well as the subscription packages. All these are available in the website, and you can get it. And trust me, with a specific guidelines, with the specific smart work, with the specific following, you can ace this test in the best possible way. Next, we have the ending remarks. The OET is an exam of efficient practice, smart work, quick response on the test day, as well as the time management. What does this mean? That as I have given you in details, that the subsections have a specific time limit, have a conceptual assessment, have a specific knowledge assessment. So if you can practice efficiently, couple of tests, as well as you can pick at the specific time limit, you can pick what is being asked to you, and the quick response, that don't get confused on the test day, as well as the manage the time specifically in the writing section, because you don't know what kind of writing section you will be given. You have to be prepared for it. You have to be prepared. You are given in 5 minutes. You have to quickly interpret the notes, and next 40 minutes you have to write it. Check the grammars, check the linguistic skills, and it will help you in acing the exam. I hope this has helped you in in guiding regarding the OET. If you have any questions, you can mention it, and I will try to respond that as I can. I hope this will help. Thank you very much. And then in the end, I will also test you based on the few questions. Thank you very much.
Thank you so much, ma'am, for your rich content presentation, which can impact our knowledge seeker surely. After your presentation, I hope our knowledge seeker can learn something new, which was our only intention. Learn and grow together, IGP knowledge seeker. Once again, thank you so much, dear ma'am, for your presentation. Now, ma'am, it's time for our question answer session, which is the one more valuable part of our regular webinar. Honorable ma'am, please stay with us. After a short video, we will back in our session part 2, which is the question answer part. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have webinar certification and quiz competition. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After another webinar certification and online quiz competition. Dear ma'am, you have to wait for a few minutes. After a short video, we will start our question answer session.
Okay, sure.
Thank you, ma'am. Welcome back, ma'am. Welcome back to our participants.
Thank you.
Knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have an webinar certification and online quiz competition. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have a webinar certification and online quiz competition. Ma'am,
Okay.
our first question is from Flomi. Good day, everyone. Good day, ma'am. Why do people fail in OET? How many attempts are there in OET?
Okay. So, Flami, why do people fail in OET? First of all, good greetings to you. So, there are four sections, and people fail in OET because of their efficiency in managing the time as well as how they can pick the question. As I've explained, that if we take an example of a reading section, you have to complete a first section A in 15 minutes. You have to get the answers right. And if you are good in part A, it will be easy to ace that section. So it depends upon the test taking ability and how much you have practiced regarding the answers. That's why, and as well as the writing section, people fail because of the grammar mistakes. You have to write the letter in the past tense if you are writing about the previous history of the exam patient. And if you are unfortunately not able to do so, it will mark the negative in your paper. Regarding the attempts, you can give OET as many times as you like, but the important thing is you have to appear in all the four sections, even if you have failed one. This is criteria for the doctors. As I'm a doctor, I can tell you that in detail. For example, if you have failed one of the sections, still you have to appear in all four sections next time to reappear in that. If you have practiced in a good way, trust me, you will ace this exam. Thank you.
Thank you for your answer, ma'am. Honorable knowledge seeker, please ask your question in the comment box for our speaker. Thank you. After question answer, we have an webinar certification and online quiz competition. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have an webinar certification and online quiz competition. After this wonderful presentation, I think there is no more question from our participants. Once again, thank you so much, Honorable Ma'am, for your time in IGP. We have learned a lot from you with new topics. It will add some value to our day-to-day activity along with our academic and professional growth. Honorable Ma'am, hope to see you again with a new topic and a new day. Thank you, ma'am. Take care.
Thank you. Thank you for having me. I hope it will help you all the participants.
Honorable ma'am, before we move to the next webinar certification process, if you want to leave this studio, you can, ma'am.
Okay, thank you.
Thank you, ma'am. Take care. IGP Knowledge Seeker, it's time for the webinar certification process, the most attractive and powerful part of our regular webinar. After a short video, we will start our webinar certification. After webinar certification, we have an online quiz competition and quiz certification. IGP Knowledge Seeker, it's time for the webinar certification process, the most attractive and powerful part of our regular webinar. After a short video, we will start our webinar certification. After webinar certification, we have an online quiz competition and quiz certification. Today's topic is Guide for Occupational English Test Exam and the code is IGP 6792. Without no one is eligible for certificates with code, you can claim your certificate anytime. How to claim an e-certificate? Go to www.eduigp.com, click sign in, log in if you already have an account or create a new account if you are new. Once logged in, click free webinar, select the webinar title and click continue course, get enroll if you haven't enrolled yet. Type the code in your certificate code box, click get your certificate. It is auto downloaded in PDF file already. Just check it. in your file manager or download folder. Don't forget to leave a review in our FB page, website, and in Google. Dear IGP Knowledge Seeker, it's time for the most engaging part of our regular webinar, which is an online quiz competition, which is our regular webinar activity. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Go to www.slido.com and find today's quiz or scan this QR code for direct joining. Quiz code is morning. After a short video, we will start our quiz session. Please join with the code and the code is morning. Please join in Slido with the code and the code is morning. Please join in Slido with the code and the code is morning. Please join in Slido with the code and the code is morning. Please join in Slido with the code and the code is morning. With 27 people, we are going to start our quiz session. Our first is first basis of AAMA certificate exam. Option 1, AAMA Board of Directors. Option 2, Occupational Analysis of the CMA. Option 2, Occupational Analysis of the CMA is the right answer. 42% people are right here. The leaderboard, Swami is holding the first position. Our second question is, of the following, which is the most appreciated use for an aptitude test? Option 1, determining the effectiveness of a drug education program. Option 2, estimating the ability of a high school student for performance in college. Option 2, estimating the ability of a high school student for performance in college is right answer. 78% people are right here. In the leaderboard, Flammy is holding the first position. Our third question is not a purpose of the AAM, Occupational Analysis. Option 1, find job opportunities for qualified medical assistants. Option 2, identify entry-level areas of competence for MAS. Option 1, find jobs opportunity for qualified medical assistant is the right answer and 36% people are right. The leaderboard, Joel is holding the first position. Our fourth question is, immigrated student recently heard English isn't primary language, did poorly and of year exam. Steps interrupt results. Option 1, the results should be presented as E. Option 2, class performance and English proficiency should be used interrupting school. Option 2, class performance and English proficiency should be used interrupting school is the right answer. 68% people are right here. In the leaderboard, Joel is holding the first position. Our fifth question is, first National Institute for MAS. Option 1, American Association of Medical Assistant. Option 2, National Center for Competency Testing. Option 1, American Association of Medical Assistants. Right answer, 69% people are right here. In the leaderboard, Joel is holding the first position. Our sixth question is, example of clinical duty for an MA. Option 1, preparing PT for an exam. Option 2, maintaining PT records. Option 1, preparing PT for an exam is the right answer. 45% people are right here. In the leaderboard, Alex is holding the first position. A seventh question is most likely to increase career options for MA. Option 1, employment as nursing A. Option 2, graduation from accredited program. Option 2, graduation from accredited program is the right answer. 56% people are right here. In the leaderboard, Gimelian is holding the first position. Our eighth question is example of a laboratory duty for MA. Option 1, supervising personnel. Option 2, teaching PT to collect specimen properly. Option 2, teaching PT to collect specimens properly is the right answer. 81% people are right here. In the leaderboard, Gimelian is holding the first position. Our ninth question is example of admin duty for MA. Option 1, creating and maintaining PT medical records. Option 2, performing phlebotomy. Option 1, creating and maintaining PT medical records. Right answers, 96% people are right here. In the leaderboard, Bimilian is holding the first position. Our last and final question of this session. Reliable test scores are best defined as scores that are option 1, consistent, option 2, useful. Option 1, consistent, right answer, 77% people are right here. Congratulations, our competition winner top 10. Congratulations again. Slido will take a few minutes for finalizing the result, and after that we will issue our online quiz competition certificate on our official Facebook page and group Institute of Global Professional. Congratulations to our winner top 10. Congratulations again. Slido will take a few minutes for finalizing the result, and after that we will issue our online quiz competition certificate on our official Facebook page and group Institute of Global Professional. Congratulations to our webinar online quiz competition winner top 10. Congratulations again. Slido will take a few minutes for finalizing the result, and after that we will issue our online quiz competition certificate on our official Facebook page and group Institute of Global Professional. At the end moment of our session, you can say properly feed your skill, never stop learning, cause life never stop teaching us. Be happy and stay safe. See you again and again. We want your participation in every program. If you want to live a happy life, try to a goal, not to people or things, Albert Einstein. Before I say or hit the end button, again wants to thanks all IGP knowledge seekers for your active participation as well. See you again in the next session. Thank you.